If you have clicked on this video, maybe you or one of your family members or your loved ones is suffering from COVID-19. In this video, I'll be telling you about few important things that you need to take care of and few things that you need to avoid to improve your health and recover from COVID-19. First and foremost thing that I want to mention here is that COVID-19 home treatment does not mean self-treatment. Home treatment is always under doctor's supervision. You must have a doctor who is treating you. This video is just to help you, just to guide you about few important things that need to be done while you are isolated. Mild cases of COVID-19 can be treated at home, but you must be in contact with either your family doctor or any teleclinic. First of all, you have to protect your family members from COVID-19. You have to isolate yourself. Be in a room that is far away from your other family members. Your room should be well ventilated. It should have appropriate sunlight coming in. Then you have to take care of your diet. You must take high protein diet and low carb and low fat diet. Stay away from junk food. Try eating more healthy food, light food that you can digest easily. Try taking more vegetables. Take more fruits and eggs. Anything that contains more proteins will help you. Anything that digests easily will help you improve. Then you have to at least take 3 to 4 liters of water every day. You must stay hydrated. Hydration improves body's immunity and helps the body to fight infection. You do not need to worry. You need to take adequate sleep and rest, because rest is very important. Your body right now is in a stressful situation. It's fighting infection. You do not need to panic in this situation. You must take adequate rest and let immune system do its job. But with rest and sleep, you must maintain a mild level of activity. When you are in isolation, when you are in a room, you must walk around that room. You must do mild exercises as much as your body can bear. Staying active, doing some exercises will help you more. If you are having sore throat, you must gargle, because gargling will kill all the bacteria and all the viruses that are present in your throat, and it will help you soothe your pain and your condition. If you feel difficulty in breathing, then you must try to sleep in this position. This position is called as prone position, in which you sleep on your belly. This position helps your lung to fill more with oxygen, and it will definitely improve your oxygenation level. What you should do is that you should keep two pillows under your hip bone and one pillow under your chest, and let your belly float in the air. This will help you breathe, and this will improve your oxygenation of lungs, and definitely it will help your lungs oxygenate more. If you feel more difficulty, you must contact your doctor, and you do everything in the supervision of a doctor. Your doctor might also recommend you some breathing exercises like inflating balloons. Inflating balloon against a pressure helps your lung open up, and they will keep your lungs healthy. Other than that, your doctors might also recommend you an apparatus with such balloons in it, and they might ask you to keep inflating it many times during the day. One important thing in the treatment of COVID-19 in mild cases at home is fever management. Controlling fever is very important. If you are having fever, your doctor might also recommend you to use paracetamol, Panadol to control your fever. The main management in mild cases is basically fever management. You can also go for cold sponging if the fever is spiking. Your doctor might recommend you some multivitamins like vitamin D, vitamin C, and zinc to keep your immune system up and keep the body healthy and full of nutrition. Your doctor might also recommend you any anti-allergic or antihistamine if you are having a runny nose, and probably an antibiotic azithromycin. You should try using disposable utensils. Anything that comes into your room should better go into dustbin than going back and spreading infection to your family. Make it a duty of one person to bring you food, water, and all your basic necessities. And that person must use PPE gear. He must wear gloves, an N95 mask. If N95 mask is not available, he should wear two or three of these masks and should also use hand sanitizer, clean himself, whoever is providing you with all the necessities to prevent spread of infection in the family. Keep yourself busy in all the positive activities. Mental health is most important. When you are in a stressful situation, stress hormones are released, and those stress hormones can weaken your immune system. Try reading your favorite books. Try listening to good music that you like. Avoid watching news. You must have two things in your room. One, a thermometer to check your temperature. You must check your temperature after every 4 hours or whenever you feel feverish. And you should better make a chart so that your doctor can see it and assess your condition. And you should also keep a pulse oximeter. Apply pulse oximeter properly into a finger that fits properly into the pulse oximeter. Wait for the red light to turn on and wait for some time. The readings might fluctuate for the initial condition, but the moment the reading stabilizes, that is the real reading, and it should be above 94%. What are the few conditions? Then you should contact your doctor immediately. When oxygen saturation goes below 94%, when you start having severe diarrhea, or when the patient has change in the mental status, you must contact doctor immediately. Wish you a speedy recovery. If you liked my video, please click the subscribe button. Thank you very much.